Ciao dear YouTube, welcome back to my channel. This morning I was half dressed when I woke up. As you can see, I have on my pajama top still, my scrub bottoms. I had woken up in the middle of the night, and because I knew that I was going to struggle to wake up for the day, I decided to put on my scrub bottoms and go back to sleep. Usually I try to wake up around 5:30, 5:45, but this day I woke up at 6:20. Then I wash my face, brush my teeth, and of course, most importantly, I put in my contacts. It's a bit of a process, but it's definitely necessary because wearing glasses with a mask is super ghetto, and I can't deal with the fogging up that happens. Like, it's just, I can't do it. So here you see me putting in my contacts, or should I say struggle to put in my contacts, and eventually I get it. Time runs down really quickly in the mornings when I'm getting ready. I'm putting on my sneakers, which are cloth. They're New Balances, but they're really comfy and they feel like I'm walking on clouds. Good morning, friends. I'm headed to work now. So today's my first 12 out of 3 in a week. These all the time. We cutting it very close now. I do live close to my hospital, but not this close. We should have been left. But I had such trouble getting up this morning. Like, sis is tired. Hopefully my patients today aren't super high acuity. Once I'm at work, I go ahead and swipe in. As soon as I got to work and got my assignment, there was literally Dunkin' Donuts waiting for us for breakfast, which is horrible. There's so much unhealthy food all over the unit all the time, and especially since it's Nurses Week, it's been really bad. After I get my assignment, I go ahead and grab a WOW or a workstation on wheels, or I get some wipes and I clean it down. I get the mouse, I get the keyboard, I get the top, the handles, everything, you know, the screen. I clean everything. This particular morning, we had gotten breakfast catered from Chick-fil-A, so I went in to go check it out. And then also, I was feeling a little bit lightheaded, so I said, let me just go ahead and grab a little bit of something so that I can take the Advil that I had. I went ahead and ate a little bit of a parfait, I think you want to call it. Yogurt, fruit, and it was yummy. Like, I was so surprised, but honey, it gave me gas, but it was good. So then I go back to my WOW. I had to steal a chair from the desk, and then I write down my assignment. So I have all of my beds. As you can see, I literally have 12 patients today, so that's a lot. I go ahead and get my 8 a.m. vitals. So because we are on a bone marrow transplant floor, it's really important that we monitor the intake and outtake of all of our patients. So we have to get their daily weight every morning, try to have them in the same outfit every time we weigh them. And then I go into each patient's room. I get their vitals, which includes their blood pressure, heart rate, temperature, pulse ox, and then I get their weight. This particular day, I believe I had 3 patients that were C. diff positive, or 2 positive and 1 potential. So I did have to garb up quite a few times during this shift into my patient's room and care for them properly. And it's now, you know, becoming second nature at this point. It's not a big deal. Just make sure I bleach down everything when I'm done. You know, we bleach wiping it up, and be careful not to get your uniform, because then your uniform will have spots. I had to take a potty break because I have been drinking my water this day, y'all. I'm trying to get my water intake up. Next, I had to go into the clean supply room because my nurse had asked me to get a stool sample, which I put in the sterile orange cap. And then I had to also get a urine sample, a clean, I forgot what you call it, a clean sample basically. Then one of my patients asked me for some water, some ice water. So I went ahead into the nutrition room, got some water and some ice, and went to take it to the patient. Now at this point, I finished my morning vitals, and now I'm getting ready to prepare for my 12 noon vitals. You can start taking your noon vitals as early as 11 a.m. and you want to get them in before 1 p.m. So basically give yourself a 2-hour window. But having 12 patients, it can be difficult, especially when some patients have different needs, such as AccuChecks and bed changes, and if they're total care, they need help with with bathing, or if they need any kind of assistance with anything. It can definitely run up the time. Sometimes our patients walk around the hallway and they get their laps, so I just put the camera down really quickly because patient confidentiality. I have not shown any patients or the information in this video, and that is for their protection and also because it's illegal, y'all, HIPAA. Patients go by and they do their laps, as the oncologists always recommend, because it's really good for them to ambulate and keep their blood flowing so there's no stasis. So here I am writing my assignments for my second vitals, and many times my rooms will change. As you can see, we had 1 discharge. There's 11 patients for me to do this second time around versus the 12 on the first time around. And after I write down all of my room assignments, then I go ahead and write down all of the requirements. So everybody gets vital signs, of course, because we are queued 4 hours on my floor. And then I go ahead and write down specific instructions for each client. So if one of the nurses asks me to do a blood sugar at a certain time for a client, or asks for a specific sample, then I will go ahead and write that. And if a client is on special precautions, I would also write that. It's just a way for me to stay organized with what I'm doing, and it helps my flow as I move through. So here you can see clients 1 and 10 have pulse ox. That's what POCT is. And then, of course, all the patients have vital signs. A few patients are total care and they don't ambulate, so they are to be repositioned every 2 hours. So that's what the R is. And then we have a few patients who are on C. diff precautions, so I put C. diff. I was just told by my nurse that my 11 is getting discharged, and he's been with me since I started there. I have to swipe into the med room and grab my AccuCheck machine, grab a few AccuCheck sticks, some cotton swabs, and some alcohol prep pads, and also the actual strips that you put the blood on. And then I get myself ready, but not before we had a code in the middle of me getting vitals again. At this point, I needed to stop and feed my face a little bit because I was, again, feeling a little lightheaded. It's kind of rough when I skip meals at work, and I haven't been good about packing anything, and especially on weekends. The main cafeteria is not open, so I just went ahead and grabbed some fruit and a few pieces of bread from the Chick-fil-A breakfast. And right after I was done, I got called into a code. My role in the code really is just to do glucose checks, but because they know I'm a nursing student, they're super helpful about teaching me things, so I'm always quick to run to the codes and learn as much as I can. Next, I had to do a few bed changes for my patients, change their sheets out, make them feel comfortable, maybe give them some new gowns and stuff like that, help them bathe. And then because we are on a cancer unit, we also have to do chlorhexidine wipes, CHG wipes, to help keep their skin free from bacteria, because a lot of them have central lines or PICC lines, peripheral lines, and those lines get really important medications that cannot be contaminated. This is the environmental services room. So after you change their bed, you put it in a little blue bag and then you toss it to be laundered, and then they come and take it. Next, I found out I had an admission. So of course, once we get an admission, we get a little admission packet, which I forgot to show you guys, but it has like, toothpaste, toothbrush, a new blood pressure cuff, and we have to weigh them. We have to get their height, and then we get their intake vitals, and then we get a sample of their urine as well to test for, I guess if you're a woman, to test for pregnancy, if you're a male, to test for your pH and a few other things. And then I went ahead and documented that information into our Cerner system. And then my charge told me I got another admission, so I had to go and get his information as well. At this point, I needed a break, y'all. Like I said, let me go look at the views from the 6 because it is so pretty. Then I agreed to help my clerk out by taking the telemetry box back to telemetry. Now, we are in a building that is on the side of the main building of my hospital. So to get to the telemetry unit, you literally have to walk 20 acres in a mile. And I'm not exaggerating, y'all. It's a smooth 10-minute walk if you walk briskly. But, I cut out a lot of it just because, I was like getting tired. My arms were shaking. It was the end of the day. Like, honey, I couldn't butter. So I finally get to the very, very other side of the other hospital to get to the telemetry unit, and then I dropped off the box, because if you don't drop it off, honey, they will call you every minute to let you know you need to bring their box back. Now we're coming towards the end of the shift, and one of the other things that you have to do in my position is to make sure that the AccuCheck machine is calibrated for the next shift, and it's called QCing. So once you are done with your AccuChecks for the day, which would be after your 5 p.m. AccuChecks, then you would go ahead and scan your badge, which is your login. Basically, you scan your strip lot, you get the strip, and then you place it in the machine, and you use the 2 designated bottles, which kind of look like eyedroppers, the green and the red, and you just check to make sure that the machine is working accurately and that it is doing what it needs to do, so that your patients are getting the proper measurements and there's no discrepancies. And this is super important in so many different respects. When there's a code, sometimes it could be just simply because their blood sugar is low. Or when they're, DKA or hyperglycemic, it could also be super important. Or even if, you're giving insulin, it's important to know what the exact blood sugar is, especially if there's a sliding scale order for the patient. So if the physician says 6 units for 120 and their blood sugar is actually 130, but you're giving them the 6 units, then they might not be able to come down to the proper range that they need to exist at their optimum body function, if that makes sense. And it's super quick. It takes 6 seconds and the countdown, as you can see. And as you can see, it's a pass.
Thursday, Friday.
Wednesday, Thursday, Friday.
What about you?
As the shift dies down, it is time to clock out. I can clock out between 7:23 and 7:30. Most days, I don't even get out until about 7:30, 7:40. And my fiance had dropped me off, but this particular day he had to go to work, so I got an Uber home. And me and the Uber driver was busting it up about lupus and medical jobs, and he used to work in the hospitals in the medical field, so it was a really good ride.
Yeah,
I always meet really nice
yeah,
Uber
we
drivers.
definitely have two. They can have two guests now. So
even in the ER.
Oh, I don't know about that. I work on a cancer unit.
What?
Cancer, oncology.
Oncology, okay.
Yeah.
I couldn't do that.
No.
They offered me a job, a hospice one time, and I couldn't do it.
Oh, I couldn't do hospice either.
Huh?
I couldn't do hospice either.
Now listen, you know, I get real close to my patients.
Yeah.
You know, and then coming to work one day and then not being there, you know, it's too much, you know. I did cardiology and rheumatology.
Rheumatology? Wow, okay. I got diagnosed with lupus. Yeah. It's 80% more common in women.
Yeah.
Yeah.
I don't give a shit how old you are. You can get arthritis at any age.
Yep.
Because there was I had this little girl, 15 years old, with arthritis. She couldn't even move her fingers and stuff.
So first thing when I come home, I strip. These are my work shoes. They're cloth, but it is what it is. So put my bottle down, put my keys down, put my badge down, empty my pockets, take off my watch, and then put my phone down, and then get me a bleach wipe and wipe everything down. So I'm gonna go ahead and wipe the phone down. Like this. Wipe the badge. Wipe the keys. Wipe the bottle. Okay, so that's good to go now. Put this away. Work was good. There was actually a lot that went on. I want to like sit down so bad, but I cannot. I don't leave the kitchen with my clothes on. I only have it on because I'm talking to y'all. We had two or three codes. And in the last code, it was a little intense. The patient has a toxic megacolon, and his colon was so big, basically it was pushing up into his stomach, like pushing it up, or not into his stomach, into his lungs. So he started to complain of shortness of breath, and that's what was happening. We had to do the x-ray, and that's what was seen. And so he had to get an NG tube, and I felt so bad for him. He was so scared because in the ICU, you know how they be rough in the ICU, because if it's an emergency, they just do what they do. So he was very scared because it hurt, and it left scars and all that stuff. So this time, they were very gentle on the floor and put it in, and then the x-ray confirmed it was in the right place. We tried to suction a little bit. Yeah, it was it was interesting cold. My arm is killing me. I'm super tired, but there was not that much going on, to be honest. I probably should have chosen a weekday for this day in the life, but you gotta take what you can get with me, okay? All right, y'all. I showered, as you can see. After I shower, honestly, like, that's it. It's time to go to bed. But I guess because I have a lot coming up this week with school, I actually am gonna stay up and do some stuff. I have my CMS practice quiz for pharmacology, so I got quite a bit to review for that. And I have an ATI assignment to do as well. And I know I'm gonna have my exam next week for Adult Health 2 on a bunch of stuff that I'm not super familiar with. Endocrine system, thyroid, GI, diabetes insipidus, diabetes mellitus, a bunch of stuff like that. So I definitely need to spend some time reviewing. and preparing some nice study guides or something so that I can review when I'm at work, because I have the time sometimes at work to like sit for like a good 30 minutes to an hour, not all in one sitting, but you know, I might have to get up real quick to go help a patient go to the bathroom or whatever, but I have the time for the most part. So I need to have my little materials available to just whip out and be like, okay, let me review this. Plus, if a different concept comes up that I'm not too sure about, the nurses on my floor are super helpful. So I can just ask them, hey, why would you give a patient this in this situation? Or better yet, if the situation is actually happening in real time, then let me so it look like I'm naked. Then I can review with them, and we can have a real life case study. And that kind of stuff is really helpful for you to like remember concepts, you know? Before I start my studies, I'm going to decompress. So to decompress, I'm just gonna either be on YouTube or I'm probably gonna put on Grays because that's really what I do to decompress. And for dinner, I have some Frosted Flakes happening. All right, this was a day in the life of me working full-time, a full 12-hour shift. I hope you guys enjoyed this video. It's not as detailed as I would have liked, but for patient confidentiality purposes, I had to do what I had to do today. Hopefully in an updated video in the future, I'm able to show a little bit more, give you a little bit more tea about the med room and how the nurses pull medications, and also my role in all of that as well. It's a wonderful learning experience, and I really do enjoy my floor. It's a good community, even though it can be stressful and I feel like I'm overworked. There's good and bad in everything. So yeah, make sure you guys like, comment, and subscribe, and don't forget to share this video with somebody who would love it. And I'll see you guys in my next video. Okay, look more.